This video will be assessing RAELYNN'S pain.
RAELYNN, you're looking cute today. Tell me a little bit about why you guys made this appointment with the pain clinic.
So as I mentioned before, RAELYNN'S been having some increased pain from after her hip surgery. For the first 2 months, she was doing awesome. Like, so awesome, we were like, she didn't even look like she had pain from surgery at all. But then after 2 months or so, she started increasingly having a little bit of pain. And we're not exactly sure why. We think it's related to her hips. In fact, we just recently found out from her doctor when they looked at her x-ray that they think it's soft bone tissue that's forming around her hips. It wasn't conclusive, but that is a possible answer. So it could be related to that. But anyway, this video is kind of like a collab. So you know that my wife, Abby, is going through nursing school right now, and she has to make a video that's kind of like a mock Zoom call between her and a patient assessing the patient's pain. So we just figured RAELYNN is a ideal candidate. We can actually assess RAELYNN'S pain using the rubric that she has to assess pain as a part of her nursing school. So that's what we're gonna do right now. This is a collaboration with Abby's channel, Nurse Abby. Check out the link in the description to see more of these kinds of videos. As Abby is actually starting nursing school now, she's gonna have to do more and more of these kinds of videos where she actually interacts with a patient. And a lot of times she's gonna choose RAELYNN as her patient. So this video will be Nurse Abby, who isn't quite a nurse just yet, but will be a nurse, assessing RAELYNN'S pain. So here's that.
Hello, this is Abby
Abby.
from the pain clinic.
Hello.
Can you hear me okay?
Yeah, we can hear you. Can you hear us?
Wonderful, yes. Oh, RAELYNN, I see lots of pandas. RAELYNN, you're looking cute today. I like your panda. Are you moving it around a little bit?
Yeah, she is.
All right, and is she awake or asleep right now? It looks like she's awake.
Yeah.
Okay. So tell me a little bit about why you guys made this appointment with the pain clinic.
So yeah, she's been in some pain lately, and we think it's related to her post-hip surgery. She had hip surgery in October, and at first she was fine, but then lately she's been having some increased pain.
So surgery was about 4 months ago, and how is her health different? How long has she been having increased pain?
So for the first 2 months, she didn't seem like she was in much pain at all. Like, we were really surprised how little pain she was in. And then after 2 months, all of a sudden it just started getting a bit worse at first. And then some days she just has really loud screaming from pain. That's not all the time, but that does happen still occasionally.
Do you feel like the pain is on a scale of 1 to 10 when she's loud and screaming, with 1 being, very little and 10 being the worst pain ever?
Yeah, when she's screaming, since RAELYNN is nonverbal, when she's screaming like that, it's a lot of pain. So I'd say it's pretty high, maybe 9. Yeah, probably about a 9.
And what about right now? Where would you rate her pain?
Pretty low right now. She's at maybe a 1. I mean, she's discomforted right now, but she's not in a lot of pain right now.
Okay. How do you know? What does she do to let you know when she's in? You said scream. Is there anything else?
Sure. So she gives us a lot of nonverbal cues. Her facial expressions. Are you okay, sweetie? Oh my goodness. Oh my goodness. So she can wince from pain, like facial expression, wincing from pain, that kind of thing. She can whimper, to whimper when she's in a little more pain, those kinds of things. She gets real agitated. She can be real fidgety with her arms and limbs, her legs, when she's in pain. So yeah, she doesn't tell us verbally because she's nonverbal, but she'll do all these like nonverbal cues.
And so it's hard since she can't tell you, but when she's screaming, when you say you think her pain is like a 9, do you feel like it comes on suddenly or gradually? Do you feel like it's sharp or dull? How do you think she would describe it?
It's either one or both. Sometimes it'll come on gradually, but sometimes just out of nowhere, she'll start screaming. And usually though, when it's sudden like that, it's because she just had a sudden movement, whether a twitchiness from herself, or maybe we changed positions and she didn't like the new position she was in. That'll sometimes lead to her screaming. But sometimes gradually too. So sometimes she just gradually gets more and more discomforted, and or she'll notice that she doesn't like the position she's in, and she wants to change her position, so she'll begin whimpering at first, and then it might increase to a screaming eventually if she doesn't get comfortable.
Do you see her muscles spasm, or do you see her legs stiffen? It's her hips that had surgery, right?
Right. I would say, yeah, I mean, she's twitchy, so her muscles spasm. And when she's in a lot of pain, yeah, her limbs can stiffen. I don't see that as a big cause for pain, or I'm not sure.
Where on her legs or hips, where do you think most of the pain is at?
I think it's her left hip is primarily. I think both hips might hurt a little bit, but I think personally, just from my observations, that it's primarily her left hip, in that, especially like if her left hip isn't elevated or if she's laying on her left hip, to me, it seems like those are the times when she might be in the most pain or discomfort.
It hurts when it's elevated?
It hurts when it's not elevated.
Not elevated. Okay, it hurts when it's not elevated. Hurts when she's laying on it. You said it hurts like sometimes if you move her, if you guys move her.
Yeah, and I would say it's not
to
even,
make it worse.
it's not even always when she's laying on it either. Sometimes she can be laying on her left side and be fine. So it's really kind of, I wouldn't say random, but it's hard to know when she's going to be in pain just from position.
What about things that make it better? What do you do to help make her feel better?
So position changes sometimes will help her feel better. If her leg wasn't elevated and then we elevate it, sometimes that can help a lot. Within a few minutes, even she can stop whimpering.
Both legs, or just the left leg?
Well, a lot of times we'll elevate both, but once again, I think it's primarily for left. But I think her right does give her some discomfort too. So we just go ahead and do both. So if she's really far down on her bed, towards the foot of her bed, because of she's in a hospital bed. Her upper body can be raised. If she's further down, she doesn't get that benefit. But if I bring her further up and raise up her upper body, that helps sometimes too. I guess because it kind of allows her to bend her hips in a certain way so that they're more comfortable. So position changes, meds help. So we've been doing Tylenol and ibuprofen.
It looks like in her chart she has diazepam, oxycodone, Klonopin, tizanidine, Tylenol. What of those things is she taking?
So she takes tizanidine 3 times a day. She takes Klonopin just at night. She's not taking diazepam. That's only for seizures to help end seizures quickly. She's having a prolonged seizure.
Oxycodone, it has down here PRN since surgery.
Yeah, oxycodone. She hasn't been taking that nearly as much, but if she's in a lot of pain, sometimes we give that for, yeah.
Mm-hmm. And Tylenol?
As needed, but just occasionally.
What does occasionally mean? How often do you think you give something?
I'm sorry. Yeah, I mean, it's changed because when she was in a lot of pain, we were giving it every 4 hours consistently around the clock. But right now she's doing a little bit better actually than she was. So it's just maybe once or twice a day, if that, not even every day right now.
Okay, and I see a doctor put in a script for indomethacin a week ago. Has she been taking that?
Indomethacin?
Mm-hmm. It says 1 capsule in the morning.
I don't know what that is. My wife might have been taking care of that though.
All right, Dr. Levin prescribed it instead of the ibuprofen, it looks like.
Okay.
Do you know if she's been taking that?
My wife's been giving it to her, yes.
Do you feel like in the last week that's made a difference? Or does she think it's made a difference?
I mean, like I said, her pain isn't as bad as it was, but I don't know if that's what was making the difference. I think it was already kind of declining just a little bit, but I wouldn't say it's better. Still an ongoing concern.
It's hard when they can't talk. What about besides medication? Is there anything else like warm baths or anything else you do, like lights out to help her feel better?
We have a bedtime routine that includes lights out. But I mean, if she's in a lot of pain, if she's sitting up, we'll change her we'll change her, put her in her bed. So, sometimes she'll just take a nap on her own because she's worn out or because of pain. So she'll take naps, and we'll turn the light out if she's taking a nap, that kind of thing. But it's not usually naps and lights out aren't something that we intentionally try to do because she's in pain. Just sometimes it's the side effect of being worn out.
How else is her health different? Are there any other changes in her health that have like kind of coincided with this pain, respiratory wise, seizure wise?
Yeah. So
Go ahead.
She's actually been having way less seizures than usual. Normally she averaged, it's changed over time, but in the prior to a couple weeks ago, she was averaging 2 or 3 seizures every day, tonic-clonic seizures every day, in addition to other like focal and general seizures and those kinds of things. But we typically keep track of the tonic-clonic seizures because they're very verbal. They're very easy to keep track of. But she was having 2 or 3 of those every day. But in these last 2 weeks, it's dramatically decreased to about, this last week she didn't have any tonic-clonic seizures. The week before that, she had 1. Prior to the week before that, she actually had a VNS adjustment. So her VNS, the settings were modified so that she's getting more stimulation to her brainstem. And we think that's what decreased her seizures. And she had a sleep study done because she hasn't always been getting the best sleep, whether because of this pain or because of respiratory issues that she's had. And the sleep study came back and said that the VNS has been affecting her oxygen level and possibly waking her up during the night, and that's part of why her sleep has been irregular. So there's been a lot going on.
Okay. Less seizures. Do you think she's more aware of her pain? Is she more alert? More like, do you feel like she's more alert and easier to communicate with?
I would say yes, but it's subtle and it's hard to quantify it. So yes, maybe.
Yeah, that is fair.
Definitely when she has less seizures, she's generally more alert. And maybe she's more aware of her pain because of that as well. But it's hard to know for sure.
Are you telling us? Yeah. Hi, Raelynn. We're going to try to figure this out. We're going to try to figure out how to help you feel better. How has this affected Raelynn's day-to-day activities or your family's day-to-day activities?
We've definitely been giving more attention to her in terms of her pain and respiratory issues than we had been prior to this. So we've been devoting more time to making sure that she's feeling okay and breathing okay.
Is she going to school?
Her teacher comes to her 1 hour a day, and sometimes her pain will get in the way of that. If she's not feeling well or she's taking a nap at the time, then her teacher won't be able to work with her. But same with other like therapists and things too. So it kind of gets in the way of scheduling sometimes.
Okay. This was a lot of helpful information, so we're going to get it all organized into the doctor. Do you have any specific questions you want to bring up to the doctor or concerns that we haven't addressed?
Well, I think I want to talk to our neurologist about her VNS and how that impacts both her respiratory and sleep, and see if we can adjust settings again, maybe. And what he thinks about that being actually a cause of her low oxygen. But as far as pain goes, I think we need to keep on exploring with her hip doctor.
Or surgeon, yeah. Neurology and surgeon both maybe need to be involved. And you said respiratory, so that's a good idea. All right, anything else you can think of? Okay, I appreciate it. Thank you for your time. And like I said, we're going to get all this written up in an organized manner and see if we can get some collaboration between Raylan, you have a lot of doctors that are going to look into this, and we will try to figure out a better pain management thing. So thanks so much, Dad.
Thanks so much.
All right. Bye-bye.
Bye, Nurse Abby.
So yeah, even though that was a mock interview, a mock pain assessment that Abby had to do for her class, all the information that we talked about in that video was about Raelynn. It was real. So that's where Raelynn is in terms of all of her pain right now. She's been in some pain, but meds help, position changes help, all those kinds of things. Hey, if you want to follow Abby's journey in becoming a nurse, check out her channel. The link is in the description. Up until now, she's been working on all of her prerequisites, but she finally, this last week, started actual nursing school. So she is officially enrolled in nursing school, and in 16 months, hopefully she'll be done and be a nurse, and she'll be Raylynn's nurse, which is cool. So if you want to follow her journey, check out her channel. It's youtube.com/nurseabby. The link is in the description. Raelynn, are you okay? Not feeling the best? Not feeling the best? It's okay. We'll figure it out, sweetie. We'll figure it out. You have good doctors. Yeah, you have good doctors. We'll figure it out.